Hello everyone. Today I'm going to discuss ALARA, which is an abbreviation for as low as reasonably achievable. This is a critical rule that is used in the medical imaging field. The goal of ALARA is to protect both patients and staff by minimizing radiation exposure. It is a principle used in various imaging fields such as X-ray, fluoroscopy, CT scans, and other procedures that use radiation. Radiation is useful, but too much of it can be harmful. According to the National Centers for Biotechnology Information, the potential risks associated with medical radiation exposure encompass several adverse effects, including a slight elevation in the risk of developing cancer later in life, tissue-related effects such as cataracts, skin reddening, and hair loss, as well as potential reactions to contrast agents utilized in imaging procedures. These effects depend on how often a person is exposed and how much radiation a person receives. The studies demonstrate that too much exposure over time can increase the chances of harm, especially if the proper safety measures are not followed. According to the CDC, ALARA means avoiding exposure to radiation that does not have a direct benefit to you, even if the dose is small. To do this, you can use three basic protective measures in radiation safety: time, distance, and shielding. This is due to the fact that even small doses of radiation can build up over time and increase health risks. This is why it's important to think carefully prior to every single scan or x-ray. In order to follow ALARA, we have to focus on three key principles, which are time, distance, and shielding. According to Kim and sporting safety literature, minimizing radiation exposure relies on three main principles: reducing time spent near the source through skill and efficiency, such as during C-arm fluoroscopy; increasing distance, which exponentially decreases exposure levels. Example, stepping just 20 centimeters further can reduce exposure by 73%. And using proper shielding like lid aprons, thyroid collars, and barriers, which despite causing discomfort, are essential to protect healthcare workers when consistently applied. These steps are simple, but they are powerful tools to reducing exposure. There are many ways to apply ALARA. For example, hospitals can choose low-dose settings for exams when possible, train staff to understand dose levels. The more workers know, the better they can follow ALARA and protect themselves and their patients, and or use new software that adjusts image quality without increasing dose. Factors such as age, size, clinical condition, and reproductive status should be considered to determine the appropriate radiation dose and shielding requirements for each patient. This means adjusting the machine settings based on the size and age of the patient, so kids or smaller patients don't get more radiation than needed. A question arises that if we lower the radiation, won't that make the image blurry or unclear? There are smart ways to reduce radiation while keeping the image clear, which is achievable through teamwork among radiologists, radiographers, medical physicists, and updated clinical protocols, performance testing, and advanced tools like artificial intelligence and deep learning to monitor image quality and patient dose in real time. In conclusion, ALARA is a safety rule that helps reduce radiation exposure while keeping the images we need. Use the simple tools: time, distance, and shielding. Also, smart technology to make sure patients and workers are staying safe is important. By following ALARA, radiation is used wisely and everyone in the healthcare setting is